Somehow people, I think, unconsciously put you in a separate category. Well, we're not normal. That would be the common usage to apply to us. But we are normal. And the manic depression, the mental illness, is part of your normality. It's not something that sets you apart or makes you abnormal.
Difficult enough managing our mental illness without managing a sort of, a bonus stigma. And also, if we don't take on that sense of stigma of sort of shame, then I think it's less likely that other people will treat us in a sort of shaming way.
I feel more open than most because I feel quite adamant about changing the perceptions around personality disorder. However, there are some places where I don't mention it.
The word puts fear in people's faces and makes jaws drop.
I say I have had mental health difficulties, but I say I've had depression. You mention the word personality disorder, they tend to back off, like, what are you going to do to me? It's difficult to know that is a feeling out there, in the press or in the general public's eyes.
And I would say that I had a breakdown, and that's normally more acceptable to people. And then they might start to ask questions, and then I'll just sort of slip in the end. Or my final diagnosis was paranoid schizophrenia. So then when the jaw does drop, at least they haven't switched off to what you're saying. So there is a lot of stigma attached to it.
Well, I see stigma as a kind of negative view that people may have about something, and as far as mental illness or mental disorders are concerned, it seems to be rooted mainly in fear and misinformation.
I definitely think it's something that people believe they bring about themselves, or that they, won't happen to them, and surely I can't be mentally ill because of this and that, and it is only for the weak-minded and the degenerates, I guess. And that's the kind of view I had of, people, which I feel ashamed about now, obviously.
Well, mental disorders are more common, I think, than most people realise. About 1 in 4 people in their lifetime will experience some form of mental disorder. And some people, I think, do believe that it's a question of mental attitude and being strong enough not to get a mental disorder. And somehow, if someone does, they're in some way to blame or at fault, and that simply isn't true. It can happen to anybody.
I absolutely didn't identify it as depression because, I was unequivocally the sort of person that would not become mentally ill, especially not with a downer like depression. I mean, maybe bipolar disorder with all those sort of wonderful manic moments, but definitely not, a downer type illness.
I would wish that society would view mental illness in the same way as they've become to accept, general disability. People don't see the internal disability of people with mental health issues, and how it can really dramatically shape their lives.
It doesn't stop you achieving. I mean, I went to university, graduated, I did all those things, and I held down my jobs. But clearly there's something going on in the brain that you're not in control of.
It isn't something that you can overtly see, and that, I think, makes it harder sometimes for people to understand. If you have a broken leg, you can show it to people. Everyone understands what a plaster cast on your leg is and means, whereas it's much harder to understand or to see a broken mind.
When I was saying, look, I'm really ill and I'm really struggling, people say, you look all right.
Sometimes it's easier if people know, but they don't know unless you tell them because they can't see it. Every 2 years they have an equalities week at work. And one strand of equalities that they'd not covered in the past was mental health. And they were looking for someone to write an article about mental health, and I nominated myself to do it. So effectively I outed myself as schizophrenic to the 700 people I work with.
I just want to be listened to and heard, and to let it be known to me that it's okay for me to feel the way I'm feeling, and I don't need to be changed, I don't need to be fixed, just to be, heard and be, accepted as I am.
I think having written that article for work, it was quite a liberating experience, really, and it made me think, well, if everybody knows, then in a way it makes it easier.
I do feel it's not my fault any more than, verrucas or leprosy are people's fault.
It is easy to be perhaps overly harsh on public opinion, but we know, for example, that 9 out of 10 people in this country believe that people with mental health problems are deserving of sympathy, and 8 out of 10 think we should be more tolerant. So the vast majority of people in this country do have tolerant and appropriate attitudes. Nevertheless, we shouldn't be complacent, and there is still room for improvement.